Welcome back to the show Talk with Your Doc, and we are talking with Dr. Mario Nucci about the anxiety disorder. Dr. Nucci, can you please tell us about more details about cognitive behavioral therapy? So who gives this treatment? Is it a physician or psychiatrist or psychologist?
Yeah, so great question. So I would say that anybody who's trained to deliver cognitive behavioral therapy, any clinician, can give cognitive behavioral therapy. So for example, myself, I'm a physician who's trained in cognitive behavioral therapy, and I do administer cognitive behavioral therapy with my patients. But generally speaking, psychologists, social workers, some occupational therapists, physicians, psychiatrists who have the training tend to administer the cognitive behavioral therapy. There are also great self-study resources for patients. So for example, if there are any patients and physicians in our audience that are interested in doing some cognitive behavioral therapy for an anxiety disorder, there are modules and workbooks they can work through, and they can have follow-up with a physician or another clinician that say doesn't have the formal training, but that can at least guide them along these treatments.
So what are these resources? Is it online or?
Yeah, so there are some good online resources for cognitive behavioral therapy. There's many of them out there. There's even apps on your phone for cognitive behavioral therapy. One I like to use is called, if you Google Center for Clinical Interventions and you click on workbooks, there are a few workbooks for anxiety, mood disorders, and other mental health conditions. And they're great sort of self-study workbooks that patients can work through that go through the various cognitive and behavioral therapy techniques. And once a patient follows through and repeats these things, they retrain their brains and their levels of anxiety go down and their ability to function improves. Yeah.
Is there any biochemical basis for the anxiety disorders, like any chemical which is released in the body which causes this?
Yeah, so it's a great question. So, the medicines that we use to treat anxiety disorders tend to be ones that raise the level of serotonin in certain areas of the brain. And, it kind of leads to the hypothesis, is serotonin, involved? And they've done other studies that show that, not everybody is deficient in serotonin. I think that there's sort of a lot of things we don't know in terms of the biological basis, but we do know that there are neurotransmitters involved in the condition. Just like there's other medicines that they're called benzodiazepines. We give them to patients, and they sort of they're sedating medications, right? We know that helps with anxiety disorders. Again, it points to this physical basis inside the brain. But there's a lot of things. For example, the genetic level of things. We don't really know why, when I get stressed out, do I develop an anxiety disorder? You might develop a different condition. Is there different gene expression between myself and yourself that's causing the underlying problems? And then what's changing at the level of the neurons in the brain? It certainly is a fascinating time for mental health research, because the techniques to be able to discover some of these things are really improving. So it's something I'm very excited about.
If somebody has anxiety disorder, is there any investigation they have to undergo through, any testing? Or?
Yeah, so that's a great question. So, one of the common disorders that can cause things like elevation in heart rate and, symptoms of anxiety, is the thyroid. So, I think a basic investigation is, investigating a patient's, thyroid function. If a patient, is having symptoms that could be explainable by some cardiac issues, I think some basic tests to rule that out, would be acceptable as well. But other than those things, generally speaking, a good history is important to diagnose.
Any protein or vitamin deficiency or anything can cause this?
Good question. Not to my knowledge,
No.
Yeah, not to my knowledge.
So supplementation of vitamins or proteins will not help in anxiety disorders, right?
That's not to say that they won't help per se, it's possible that some protein supplementation might help. One of them is called tryptophan, but tryptophan ends up making serotonin in the brain, but we don't have the level of evidence for me to be able to say, if you take this much, you'll get this benefit, for example, right?
So somebody has anxiety disorder, he undergoes thyroid testing and blood pressure and heart testing and everything is normal,
Yeah,
then it
yeah.
is a anxiety disorder then.
Essentially, yeah,
Right.
yeah.
Now, if somebody is not treated, what is the complication of anxiety disorder if is not getting treatment?
Yeah, so it's kind of like, you have this chronic fight or flight response, so there definitely is, adverse physical issues with patients with anxiety disorders. People with anxiety disorders, because they have this chronic stress response, they tend to, get more sick. They tend to be at higher risk for, cardiovascular disease and other mental health conditions as well.
Does it lead to depression?
Very much so. So, patients with anxiety disorders often tend to have, major depressive disorder as well, and vice versa.
Okay. Now, how can we prevent these anxiety disorders?
Good question. So, I think that, in general, sort of self-awareness as to one's own anxiety and one's own predisposition to anxiety, and if you have an anxiety disorder, to seek out the treatment. But stress reduction, I think, is very important for managing overall stress and managing, triggers for anxiety disorders. So, things like mindfulness techniques, things like all of the lifestyle things that I recommend to my patients that are protective. So things like socialization, things like exercise, things like spending time outside, spending time in nature, taking breaks, learning deep breathing techniques, maybe some meditation.
Yoga, meditation.
These types of things, exactly, yeah.
So those can help to prevent, even they should be started from the childhood then probably.
I think that one of the things that I actually believe in is having people understand mindfulness and how that can, help people manage their emotions and manage, their thoughts and their stress and some of these techniques, if they were taught to younger kids, I think, we could prevent potentially anxiety disorders and help people be happier and function better in general, right?
So training from the childhood onwards can prevent all these mental disorders.
I think, I don't know if we have that level of evidence, but it's my speculation that definitely would be the case, yeah.
Thank you, Dr. Nucci, for coming today and helping us to understand anxiety disorders.
My pleasure.
Thank you, everyone.